Negotiating an existing employment contract has to be one of the scariest things that we actually do because we actually don't know how our boss or our supervisor, our clinical chief, HR, how they'll respond to it, especially because, as we all know, leaner and leaner times post pandemic are occurring in the healthcare sector. And so I wonder currently in 2024, what tips do you have for healthcare professionals to prepare and initiate that conversation?
Yeah, I'm glad that you talked about the some of the fearful kind of anxieties that come along with renegotiating your contract. Because when I started the business, I thought, well, this is going to be easy. Doctors are obviously underpaid. I saw that from my career as a healthcare executive for 15 years. But what I've learned over the last 5 years of running my firm is that it takes a lot of courage to ask for a salary raise. And that's where I often articulate that when you work with doctors as a coach, you're likely treating some underlying, let's say illnesses or symptoms that a doctor has relative to their career, their life, and maybe kind of some of the unmet expectations. My work is much more superficial in the respect that I treat the symptoms that lead to doctors coming to you. So, thinking about what leads to burnout, being overworked, underappreciated, and under supported in your practice. So, I would say the first thing that doctors need is courage. It is incredibly difficult to ask for a salary raise or to even suggest that you might not be paid what you deserve. So anytime I talk to doctors, I tell them there's two non-negotiable parts of the process. And this is what often scares doctors away or keeps them in toxic situations. And I'd love to hear how this reflects with your experience with your clients. But the first thing I mentioned is courage. You must be willing to stand up for yourself and say, I deserve better. My patients deserve the best version of me. And in order for me to do that, I can't be distracted by not being paid fairly, being paid less than my colleagues. Or more risky is I talked with a doctor a couple of weeks ago who said, she called me out of the blue and said, Ethan, I'm the only person in my clinic today. There's no MAs, there's no admin person. And so she was left to do everything. So despite the toxic situations doctors may be in, courage is the first non-negotiable thing that they need. And secondly, what doctors need to do, and again, this is really scary, is doctors need leverage. The only way, tried and true, that I've seen doctors gather leverage is by getting a competing offer. Now, doctors then ask me, well, I want to stay with my current practice. Why would I go get a competing offer? I can tell you the treatment protocol based on 15 years of hospital executive experiences. In order for your employer to take you seriously, you must get a competing offer from around town. So a big part of my job is helping doctors understand here's how you create leverage. And I think the surprising thing for many doctors is that it's not just about how good of a doctor you are. You're an amazing doctor. It's not just about how much your employer loves you. They probably, they're over the moon about you. But that unfortunately does not create power in your contract negotiations.